Dr. Etomi, thank you for joining us on the News at 10. And we must commend you and your colleagues all over the world who've been attending to those affected with the virus. It must be really strenuous. What have you seen so far? What's your experience been like since this outbreak of the coronavirus?
I can tell you that it's been one of the most apprehensive moments I've had as a practicing physician. It's really one of those situations where you get into, you are not sure when you go to work. But what is more concerning, though, is that the panic that is created by all the issues around the virus sometimes can be just as bad as the disease itself. So one of the things we've got to find out here is to get the public very calm and make them understand that, yes, this is a deadly virus, but also understand that most people will recover. So once that message is in there, you want to reduce the panic. Once you reduce the panic, you want to also go into the mode of complete lockdown. Why do you want to do lockdown? The lockdown is to give a chance so that the spike that can occur when the disease really hits is really blunted. You want to flatten that curve of transmission. And this is what Italy missed out on. And you can see the price they are paying. And New York is now going into the same thing. So lockdown is a sacrifice we all have to make. We all make it here. Now, there will be some economic consequences, but that's understandable. But if the lockdown is done properly, which could last anywhere from a month, sometimes to 2, 3 months, then we can actually go through this most difficult phase of, I would say, the medical life of Nigeria.
Yes, and I know lots of people have been panicking, so it's important you say that people really need to avoid panic at this time. And I know a lot of people also want to jump forward to thinking about a vaccine for the virus. Do you think that's one in sight?
Well, the thing about vaccines is that there's none immediate now, but everybody's working on a vaccine. But to remember that to do a vaccine, you have to keep testing. And that period of developing the vaccine to testing will take anywhere from 12 to 18 months. So we are not going to be seeing a vaccine just right off because you have to continue. The scientists will understand the behavior of the virus and develop the right vaccine for it. So we're not going to be seeing that anytime soon. But just as important as the vaccine is the individual. If we all practice, self-sanitation, the message is out there, what we must do, we can actually really stem the rise of this virus. We have to understand the biology of the virus. This virus is such that it can be easily killed by soap and water over a period of time and by any alcohol-based solution. So we are using sanitizers, but the question we have to ask ourselves in a place like Nigeria now is that there are so much economic consequences when we lock down, there's disease. And it comes back to the base fact that in Nigeria, there's so much we must do for ourselves. We must be able to produce sanitizers in Nigeria. We are a very clean society when we have to be, and Ebola was a lesson for us. But if we continue to be indifferent and continue to take things lightly, then it's going to create a lot of problems. Other issues that are very important are the faith-based problems that actually we are faced with.
Right.
We must listen to well-organized groups, medical groups, information centers to get our information. If we
Dr.
get our
Tommy.
information from the wrong quarters, from a lot of social media that sometimes are actually hype and false, then we're going to create a lot more panic than we really should be doing that. So it's just as important talking about vaccine as much as what we do about personal hygiene. And that is the point that everyone must understand. You must wash your hands as frequently as you can. You must use sanitizers. Anywhere you go to, you just have to change your culture. Someone who spoke earlier mentioned that this is going to be a new thing in our culture. Yes, it's going to be. But that's the way it has to be. If you do that most of the time, you
Right.
can actually, in so many ways, limit the spread of the virus. Education is the key. And like I keep telling patients, nurses, when we work, it's education, education, and education. And I want to thank you guys, Channel TV, for what you have continuously done. The Association of Nigerian Physicians in the Americas have continuously engaged the Nigerian government in wanting to improve the overall health of Nigerians. This is one real trying and
Dr.
testing
Tommy.
moment.
Dr. Tommy,
Yes.
thank you. Thank you so much.
Yes.
We do appreciate you also commending Channels TV, and we thank you for your time, for your service right here also on the News at 10. Thank you again for joining us on the news.